Hi, my name is Katherine. I'm 27 years old. I'm from Colombia, and actually I'm the surgical coordinator for Mabel Health. Basically, what I do right now in my practice is a lot of several tasks, including the fact of being bilingual, the most important. I have to handle almost everything related to translations. It could be picking up a call or making calls to schedule appointments, reschedule appointments, sort out, kind of translate anything billing related or with authorizations. And since my main task is being the surgical coordinator, I have to call patients, coordinate their authorizations, and schedule them for the different surgery centers. Both our doctors are currently credentialed in. Besides that, I had to review all of the imaging that is received by our faxes and make the providers aware of any pathological findings I might see around. Also, I have to translate almost all of the intakes that are being brought by us to translate everything that the patients need to make the providers aware and vice versa. And it's basically that. Well, I remember, since I am the one who has to do all of the surgical scheduling, since we are handling pain management cases, all of these patients would like to be scheduled as soon as possible. So we are having some issues with putting the dates too far in advance. So I have had a lot of patients calling because they want to be scheduled as soon as possible, and that's what happened once. I had to schedule a patient the next date available was within 3 weeks. So I had to run and offer all of the other options in the office or anywhere else. I had to discuss that with the provider, and I told the patient I would call him back, and I did. We found a way to schedule that patient in the office within 3 days. We bumped up the wait time from 3 weeks to 3 days, and that's when the patient became really thankful for that, and that happens a lot. It's no secret that there's always a language barrier between Spanish and speaking, because we may say things that we are not meaning to say. So what I do is try to translate as the most accurately possible to the patient and to the provider. So really an awkward and uncomfortable moment could turn into a funny one. So I've had a few opportunities when I had to translate and try to make that awkward moment into a funny one with a lot of patients, because maybe the doctor wants to say something that he isn't really intended to do. So I try to put that into a more professional way for the patients, and that's a lot better for them. So yeah, I think that's the most important thing.